Hey everybody, it's me again. It's been almost a year, actually about 11 months since I've posted a video on this YouTube channel. Last video I posted, I believe it was talking about my frustrations as a new grad nurse on a critical care floor, and being on my own for the first time. And I kind of just wanted to hop back on here really quick, and kind of give an update on that video. I know it's reached a small amount of you guys, but I feel like, an update would be pretty cool. I recently got a message asking if I still feel that way, so I wanted to check in. So essentially, when I first started, when my first job as a nurse, as a new grad, I was on what's called an intermediate critical care floor. That's my dog, say hi. And basically it's like an ICU step down. So we get post-extubation patients, we get trach vent patients, very chronically critically ill patients. Obviously they're very sick, so they're very high acuity and everything. So it was a very tough floor to start on, and I was on orientation for about I want to say maybe 6 months. And after 6 months, that first week that I was on my own is when I posted that video. And I remember the shift I had specifically. It was the first time I ever sent a patient to the ICU because they were so sick. And I remember the feeling, and I remember feeling overwhelmed and like I didn't know anything, like I wasn't good enough, like I couldn't keep up. I know I would stay until like an hour or two later just to finish my charting and everything. So I remember those feelings very very clearly. Long story short, almost a year has gone by since that video, and next week I actually start my job in the cardiovascular intensive care unit. A huge jump. It's actually been my dream to start on, not to start, but to actually work on the CVICU. It's, to me personally, it's like the pinnacle of like bedside nursing careers. So I'm super excited to start. But ever since I posted that video last year, so I did about a few more weeks on that same floor, and then that same floor expanded to another unit. It's like the sister unit, and that's what I was part of. I was part of that staffing, and that same unit ended up turning into a COVID intermediate critical care floor, and I've been working that same COVID floor since February. At first, when everything started happening, the acuity wasn't too bad. People were sick. We didn't really know what was going on, just like the rest of the world. And so we were kind of just like doing it shift by shift, like, our knowledge base. But in the past month or two, the acuity on our floor has increased significantly. We're getting very, very sick patients. Where pre-COVID times, these patients would be considered ICU level. They wouldn't be on any blood pressure drips or anything right now, the patients that we're taking, but respiratory wise, they are ICU level. But we were taking care of them. That's our floor. We're in intermediate critical care. And so we're taking care of these very acutely ill, very, very sick respiratory patients due to the COVID. And I've learned so much. I've seen things that I never thought I was going to see. Situations, sorry, that's my dog again. She's excited. Things that I never thought I was going to see at such an early stage of my nursing career. And I feel like I've grown so much in the past year and a half working on this type of floor, and being able to have the opportunity to work on this type of unit where anything can happen at any given point, where if you're not on your toes, you're going to miss something. And I feel so fortunate. Now, as far as my confidence levels, I definitely feel more confident. There's days where just like with every job, just like on any unit, it doesn't matter how much experience you have. There's days where I don't feel the most confident because I'll be encountering things that I just don't know. But I take that opportunity to learn. I take that opportunity to research. I ask questions. I've become more confident in the fact that I feel confident in asking the physicians involved in this care, or even those who are not, but I'll get their input. Questions about the care, about medications, about treatments, and then we actually have knowledgeable conversations sometimes about what is going on, especially with this whole COVID. I've had the confidence, I've grown as a person enough to be able to have actual conversations regarding courses of treatment and what we can expect to happen with patients and what's the best thing. And, you know, sometimes I'll ask for my opinion on the course of treatment, and I feel confident enough to give my input. Whereas last year when I posted the video, I did not. I was like, you're the doctor, I'm the nurse, I don't know anything. But in just this short amount of time, I feel like I've gotten the confidence for it. So I mostly just want to say to anybody that watched my previous video, I did feel like that for a while. But with time, with practice, with failures, with days where you're just like, I don't know what the heck I'm doing. You know, things to get better. You learn a whole lot, but you have to be able to be open-minded. You can't close yourself off. If you see something cool happening for another patient and you have the opportunity to see, like, go check it out. Ask the nurse questions. Hey, what's going on with so-and-so, and like what kind of medications are they on? Like, you have to go out of your way to learn. You have to be able to help when you can and just explore, you know, like there's so much going on every single day in a hospital as a nurse that it would be silly to just close yourself off. So if you have the opportunity, seek chances to learn and expand your knowledge and your skills, and don't be afraid to ask questions, even to the doctors. Obviously, if you're a new grad, it's a little intimidating. You're like, oh, I don't want to look stupid, but that's the whole point. They were in training for 8, 10, 12 years and have been practicing this for X amount of years now. You are just now starting, you know, ask questions. You're not expected to know everything right off the bat. You know, you went to school for 4 or 5 years to become a nurse, and only 2 of those were your actual nursing program. You don't know everything. You're never going to know everything. No one's ever going to know everything. So I really just want to emphasize that. And I think that is so important to be able to reach out to people and like let them know, hey, it's okay. Just ask whoever. Like I said, there's days where I still don't know what the heck I'm doing, and I'm literally just checking stuff off of a task list. But at the end of the day, I try to reflect a little bit, like, what did I do? What did I learn today? Did I learn anything today? And what could I have done better? And especially when I have very, very critical patients, and for some reason or the other, they get sent off to an ICU, or, you know, whatever happens, I'm like, what could I have done better? And I ask those around me that maybe knew what was going on, what could I have done better as a nurse? Who could I have reached out to? What could I have asked for there to be a better outcome? And 99% of the time, there's nothing you could have done. Another thing I want to bring up is the fact that with time and with more practice, your nurse's intuition is going to get so sharp, where some days, and I can tell you from experiences because this has been happening to me for about a few months now, where you walk into a patient's room to do your morning assessment and you're kind of just looking around and you know the story, you know what's been going on, you know the progression of their stay. And at one point within those first few hours of the morning, you're going to be like, you're going to think, and you're like, what's going to happen with this patient? What is the worst thing? Like, you can kind of sense that something may happen with this patient, and you're going to know, even if you don't know what it is, you're going to know that you have to work extra hard on that patient so that nothing happens. And if nothing happens by the end of your shift, success, you know. And even if something does happen, you knew and you were trying to work your butt off to not let it happen. And sometimes we're successful, sometimes we're not. It's part of the job. But to start ending this video, you know, I've grown a lot as a nurse in the past year. I've seen so much, I've done so much, and there's still so much for me to learn. And in the past year and a half since I started this job, I feel like I've grown confident enough where I can try a new adventure, a different unit, and it just, thankfully, I was able to get kind of like the unit of my dreams. I don't really know what I'm getting myself into, but I'm excited to learn. I'm excited to see different things. I'm excited to just, I don't know, just experience everything. You know, I'm not a new grad. I have a lot of knowledge and I have a lot of foundation now. I have a lot of knowledge under my belt now, so I'm not going in blindly completely. It is a CVICU, so there's tens of thousands of things I'm going to be like, I don't know what that is. But I will use what I do know and what I have gained in order to just be the best I can. And that's the only thing we can all do, you know. Every day we try to learn something and we take it with us and then just use it for whatever, you know. So I hope this was kind of an update on that video, and I answered anybody's questions on, you know, a year later, you know, if it's still like that, if it gets better. But seek out what your passions are, seek out what your interests are, try to think about where your heart and where your gut is directing you to, because I'm a huge believer that the universe will push you into the direction you're meant to be, regardless of whatever situation you are in life. So I've seen it happen with myself. I've seen it happen with many people around me. So just trust in yourself, believe in yourself, work hard. Like I said, seek opportunities to learn, to expand your knowledge base, and to just keep going, you know. Especially as a nurse, there's so many options out there for us, and we really just have to be willing to maybe feel dumb for a little bit to be able to feel confident at a later point, you know. That's kind of what I think. So keep your mind open, keep your heart open. Always listen to your gut. As a nurse, that's one of the main things that you're going to learn how to do. You're going to learn how to really just listen to what your gut is telling you and then just act upon that. Ask questions and just keep moving forward, you guys. The world is your oyster. Even in the middle of this pandemic, there's a lot of options out there, and hopefully you get to go after them. Okay, so it does get better, does get kind of easier. But nursing is nursing. Every day is something new, so, you know, charge on, kind of like my school. All right, so take care, guys. At some point I'll talk to you again. Bye.